Sure.
One. And we're live, guys. Welcome to the famous, if not infamous, Bloody Tooth Guy. We crossed our wires when we tried to do the 24-hour podcast. We got our BST to EST very mixed up, and we missed you, and we really missed you on that. It would have been great to have you sign off, but we've got you finally. How are you?
Yeah, I'm doing great, and I have to, before we do anything, apologize again to you. That was totally my bad. These time zone thing to me is a very challenging concept, so please accept my true apology, and I'm happy that we can do this now.
No, it's absolutely fine. It was a great day, and it was a day that's kind of we're gonna do another one next year. We're doing this yearly, so I'm sure you'll be around for that one, God willing. Um, but
Well,
tell me,
count
how's your
on it.
day been? Just let's just get in there. What's been going on today?
Today was a pretty typical Friday. Fridays I see only procedures, no consults, no follow-ups, nothing like that. So got in at just before 9 this morning, saw patients till now, and now I have the great honor and pleasure of speaking to you.
Awesome. Yeah, I think the first thing that I was gonna start asking people is if you had your own podcast, let's just pretend you can have three guests from anywhere in the world, any walk of life. Doesn't have to be an oral surgeon, dentist, anything along those lines. Who are your three guys that you're bringing in, and what's the reasoning behind it?
All right. So, I've been asked, like, who would you go to dinner with or who would you interview? And, I don't want to give like a cliche answer, but honestly, I would love to have a conversation now as an adult with my grandfathers, both of
Mm,
them. I think, I'm 46 years old. So to have the life experience that I do, to be able to kind of sit back with guys who have done it, who have been through it, and just get perspective on what they were doing that maybe I didn't know about as a kid, it would be a tremendous, tremendous gift for me. So my grandfathers would be cumulatively number
yeah,
one.
makes sense.
Uh,
Makes 100% sense.
Number two, yeah, I mean, I think, obviously as you grow, you gain perspective, but to be able to actually, with that perspective, ask questions and get feedback and get guidance and things like that would be invaluable. So that would be number one for sure. Uh, Number two would, I think, be Gary V.
Yeah,
You know who Gary V is? Gary
yeah, yeah, yeah.
Vaynerchuk. So it's interesting to me because I've seen him live and I watch him, and I mean, he's been doing it for as long as he's been doing it. He's got perspective, and when I watch him, it's not so much that I learn so much from him, but I do. When I watch him, it kind of reinforces to me that I kind of am looking at things in the way that is a positive, proper way from the medium that we're existing
Yeah.
on. So I think I'd like to clarify some things and like just kind of talk to him and pick his brain and just bounce some ideas off him, because I'm in a place now where I've been very fortunate to have built a practice that is a successful practice. Uh, and I now have built this Bloody Tooth Guy Instagram presence, and to maybe figure out the best way to marry them and where to bring it. And I think just maybe some perspective on that.
What is it you think you're missing
I think
at the moment? Because from where I'm sitting, I'm just thinking this guy's got it made. So what is it that you look at and you think I'm not quite I'm not quite where I want to be with all this?
all right. So we're talking about Bloody
Yeah, yeah.
Tooth
Let's
Guy.
just go off on that tangent.
Yeah. So I think for me, there's so much opportunity with the number of eyes that are on my account on a day-to-day basis, and the amount of influence that I have within the especially younger dental community, that there's a lot of continuing education opportunity out there. I think right now it's a difficult time because I'm not one to prepare a lecture and put up slides and do anything on Zoom and be comfortable with it. I'm actually fine in this type of
Yeah,
venue. There's no preparation here. You ask me any question, I'll give you my answer. It's going to come
yeah.
from the
It's
heart. It's going to
raw,
be real.
unscripted, and
I
authentic, whatever
mean,
you want to
it's,
say.
I
Yeah,
yeah, I love that, and I think for me that works, and I think that that's for me part of the allure, part of what the audience likes. But I do think having some sort of continuing education facility I'm not talking about a hard facility, but the ability to do continuing education is something where I really could take this, which would be great. I also think that in an industry that is so focused on progressive technology and advancing our profession through technology, it's a little interesting to me that most of the larger companies with the major backing don't understand the influence of social media to the younger dentist, right?
Yeah, no,
So if you
I
think
get that
about it,
because I spoke to, I can't remember. It's one of the three big ones. It might have been I can't remember who it was. So I won't libel anyone by association. But I said, look, I'm doing a giveaway. Do you want to give something into it? You know, we'll get a lot of eyes on your page, and you know, the next generation of dentists tend to follow me, for whatever reason. Then and they came back and they're like, oh no, we don't really feel like it. We've got a budget for traditional. We've got a budget for print. We've got a budget for other things, but not something like social media. And I was like, okay, fine,
right?
but it didn't really make sense to me, the way they were thinking.
Yeah, I think the thing with traditional marketing versus where things are right now, and the average attention span, and the average way that a younger consumer is actually like deciding where they're going to go buy their goods or services, there's been a complete shift. And I think that the traditional marketing execs don't really understand it, and they don't know. I think it's because they can't really figure out what the ROI on that type of stuff
Yeah,
is. They don't know how to monetize it. And you know, I've spoken to plenty of guys from different, I mean, real heavy hitters in some of these companies who, you know, so I give them a post. Like I posted something yesterday. I took a wisdom tooth out, and in that post, just on the actual post, I think the reach was like, I don't know, 100 something thousand people, whatever it was. And I'm using an elevator, and I'm using a suction tip, and there's whatever else could be in the background of
yeah,
that. And it's such an opportunity for product placement. It's not like I'm going to use something I wouldn't automatically use, but I'm using a specific elevator. Anyone who watches me knows that I do that every time. I'm asked every single day, like, what elevator is that? Where can I get that elevator? Whatever it is.
mm,
I can do that with 1,000 different things that I believe in. Um, and they just don't know how to do it. They just don't know how to, they can't figure it out.
yeah.
I mean,
It's
and I don't
strange.
understand that.
Because you know, I mean, there'll be a Matrix band, for example, and if you watch this space, you know, you're an neurosurgeon, so it doesn't really impinge upon your sort of work. But there's a Matrix band company that I'm very well affiliated with, and we're talking about how can we, you know, help them out. It's one of my university professors, and you know, we spoke about a lot of these things, and he kind of gets it, but he's from a younger generation, so it's almost lived experience. He's a younger guy.
Right.
He lives social media a little bit more. I think the guys at the top of these almost dentistry type Fortune 500 level sort of companies, you know, whatever the top of the game, there may be older guys in the 50s, 60s, 70s, you know, just looking for what worked in their day and their kind of mentor's day, whereas the advent of the
Yeah,
internet's just changed it.
yeah, but you know what? I actually don't. I mean, I believe that that is fully what it
Mm.
is, but I don't accept that as like a
Oh
good
no, it's not.
reason
No.
because no, I mean, so I'm 46. I was anonymous for a very long time, and people had no clue how old I was when it all started, and people perceived me to be considerably younger because I was so involved in it. Again, I was totally anonymous. No one saw me.
Mm.
I'm clearly in my 40s, but the fact is you need to understand if you're going to kind of, I mean, at any point in your career, where do you have to move? Where do you have to pivot? You have to be ready to do that. I mean, in these companies, I think they rest on their laurels a little bit. They rest on kind of like the traditional relationships that they have, but things are changing. Even before COVID, there was a significant decrease in participation and attendance at these large scope events, you know, like who's going to Chicago in the middle of February, right?
Yeah, I
Well, you
went.
want to because you want to go to Chicago and you want like the Cheval burger and you want to enjoy Chicago, right? And
Yeah,
like, yeah, you'll go to the booth and it's great and you network with people, you
I
see
went to
old
network.
friends, and
I 100% went to network because I thought, well, I was on 12,000 followers when I went to Chicago. I thought, look, I've got an opportunity to make something of it. I've got the opportunity to go and, well, actually, I wanted to do endo training as well. So I went to Brett Gilbert's lecture, who's another guy who's in your kind of age bracket, who's really kind of out there and showing guys what's possible for more experienced clinicians, and he's a super positive guy. I mean, he's probably the you of endo. That's probably I would
I'll
say.
take that.
But yeah, you're right. There were considerably fewer people around my age, and I went to one of the mixers, and there was what 50 people, 60 people there. They
All
must,
right.
that's not the population of young dentists. Is um, completely missing the target there a bit. Big thank you to everyone that's joined us, by the way. We've got Kyle who's saying he'd definitely take CE from Bloody Tooth Guy, and Dr. Awua saying he's one of your biggest fans.
I
So thank
appreciate
you all for
that
joining us, guys.
tremendously.
Yeah, I mean, do you see the same sort of thing? Maybe, I mean, going off really off topic in the car industry, with, for example, the old school manufacturers such as Ford, your GM, where we're coming up against something like the Tesla, who are vertically integrating things, and it's direct sales model via the internet. So you can just go on, you can just go
Absolutely.
online and order the car. You don't have to go to this guy
All
who's
right.
going to try and sell you a load of crap.
100%. So, uh, you know, I'll speak to what the situation is in the United States, or was in the United States. Yeah, you'd go to a car dealership. You'd have to, like, before the internet. So this is like an actual
Yeah.
thing. Before the internet, nobody had any clue what they were supposed to pay for a car. So it was really a game. You'd walk in, you'd talk to the sales guy. He'd say, "Oh, let me go talk to my manager." He'd go to the manager. The manager would write some bullshit on a piece of paper, bring it back, and you'd have to go back and forth like some sort of game. That what happened with the internet, which again we're talking generation decades now, but what happened with the internet is information was available to the appropriate consumer. That information was able to be used to get like a better deal, and then now it's like, why wouldn't you just go to Tesla if you're into that type of vehicle?
Whatever you're after.
Right, whatever you're into, and say, okay, this is the number. There's no games. There's no all, like, it is what it is. I'm actually, it's funny. So it's a little crazy. My daughter is turning 17, which is the age that you get your driver's license where I live. And so the next move is a car for my daughter. And so I'm actually looking at a couple of different car companies. And I will tell you, Tesla does it differently. And I like it. I like it a lot. And actually, so just to kind of full circle it, and we don't need to go so deep into it, but, I mean, Elon Musk is a guy I would love to talk to if I had a podcast.
Mate, wow.
Because
would you give him some
I
weed?
mean, the guys
legally.
Would I get, so New Jersey? I practice in New Jersey. New Jersey, just whenever the election actually was, I suppose Tuesday, which is what we're all dealing with here. It passed recreational marijuana in the state of New Jersey. So, I mean, things are changing. The times they are changing, and Elon, I'm sure, is pretty happy about that.
Yeah, he's an incredible guy. I mean, I read it earlier that he didn't, when he went all in on Tesla back in 2008 at the Wall Street, or was it 2012? Apparently, he had to call for his friends to pay his rent. He literally went that all in, which is crazy. So yeah. Oh, got a question, Doc. Would you consider having a PCS work for you? This is the story you put up the other day, right?
Oh yeah, absolutely. Yes, I need that. I will tell you. So I'm in a part of what I need to do for Bloody Tooth Guy is affected by the fact that I actually do what I do for a living, right? So I am in my office every day, seeing patients every day, and I'm the managing partner of my practice. So I'm a clinician. I run a 6-office business with 54 employees that I started, and I run this Bloody Tooth Guy thing. I don't have, like, I know my limitations. I do not have the bandwidth to do all that is necessary. And so I'm limited. I need creative people. I need people who are much more savvy than I am. I need people who can take the content that I actually do, that I put out there, and cut it up and put it on different forums. Like, I have a YouTube channel, but I don't really use it. I have a TikTok thing, but no one wants to see me dancing like an idiot. I have Snapchat, but I couldn't even, that's ridiculous for me. And Instagram is kind of where I've focused, but I think there's so much opportunity I have so much content, it just needs to be cut up and distributed appropriately. The problem that I have found that I've run into is, if you watch me, if you follow me at all, it's all me. I've never not once had somebody post something
On your
for me or
behalf.
anything
Yeah.
like that's right. So when it coming, it's my voice every time, and it's very difficult to duplicate that. And I think that I, I think that's where, for me, I have a very difficult time kind of conceiving of how to take this to the. I think the videoing is one thing, the
Yeah.
recording, the editing can be done, but I think the voice, the commentary, all has to come from me.
Well, that's what
And
people
that
want,
that
because I mean that's probably why you've grown so, explosively in a way, because you get that feel of, okay, this is a guy who's actually doing all of this. Whereas, and it's because it's videoed, you can see it going and happening. Whereas with other people, maybe they're doing before, after, it's just a picture and a picture. And you're just like, well, that could be anything, there's nothing extra. I'm not seeing the intricacies of how he moves his luxators, or, how he's doing stitches, whatever it might be. So I think part of that authenticity almost limits you in the way it sounds.
I think
Mm.
so too. I mean, look, it's a good problem to have, right?
Yeah.
So I'm happy to do it. I love it. I really do. It's a great outlet for me. It helps because I'm a pretty creative human being. I happen to really like it. I love to do the surgery. I think that comes through. I think I'm pretty good at it. And I love the business of what I do, right? I love acquiring practices and putting deals together. And I love that. And I get a fix from
Yeah.
that. And my creative side is fed through the Instagram. Plus, it's good for my ego. I mean, you talk about like
Oh, damn
it
right.
really is. I mean, I go through DMs that I'm inspirational, or that they're a fan of mine, and it's like I'm just a guy from New Jersey, and it's a great feeling for me.
Do you get
Because
worried by it
it's nice.
at any point where? Because I mean, I'm very early on in my career. I only graduated, what, 2.5 years ago, something like that, and most of that's been COVID and travel and
Right.
traveling. So I'm very early on, but I mean, I have done something with Dents of Insta and my own page, because I really love photography, videography. I don't know if you saw, I did a video shoot from one of my friend's aesthetic patients. He had some influencer come in. We did like a coming in sequence and what are you expecting today, all that sort of stuff. So in the same way, I'm nothing special. I'm just someone who likes a camera and uses it. Um, but people will start, once you get to a couple of thousand followers, they start blowing smoke up your ass a little bit, and you're not really anything that
Right.
special. You're just a guy with a camera, and you're
Right.
consistent in
Well,
posting.
yeah. I mean, I think I'm in a very fortunate position that I don't, and this is going to come off like a little douchey, but I don't need to do this for any other reason than it's like I
Yeah,
enjoy it. So I'm not I have my business. I have a
you got a
practice.
whole other thing going.
I have a family. I have my friends. I'm in a very different place in my life than younger guys
Yeah,
starting out who want this to be what they're doing, and you're doing an amazing job, period. And there are a bunch of guys out
yeah.
there
Thank
who
you,
are
man.
doing a good job. No worries. But like you can see when people do it because they love it,
Yeah,
because you're all in, and you can see when people are doing it. I get questions like, should I be an oral surgeon because I want to make a lot of money? Like, that's the least thing that you should. I mean, I know when you're young, everyone wants to be successful and make money
yeah,
and all of that, and of course, and yes, being an oral surgeon, you do all right. But the fact is like, no, if you're not passionate about what you're doing, whatever it is, in any forum, that is not a long-term recipe for success. So for me, I'm lucky, so it doesn't scare me, because if it went away tomorrow, I would miss it tremendously
yeah.
because I love it. But but no, I don't. If I never made a dollar from Bloody Tooth Guy, it will be okay.
Yeah, I think
Truly.
I think that's the thing, but it's also that idea of feeling like you're a big thing, which I've you speak to some guys, and they've got a certain number of followers. I've asked people to do a quick live or something like that, and they go, "Not at this time. I'm far too busy." Blah blah blah. Give you all of this, and you're just like, "Okay, mate, fine, whatever." Just
Right.
but it's just
Yeah.
interesting to hear. the different kind of ways of doing things and how you've incorporated within your life. And obviously, you've got a lot else going on, and that's probably the right way to do it. You know, this is just one little facet of 100 other things that are going on for you.
Right. This is true. I mean, I will tell you, just from the like the fame-ish part
Yeah.
of it, I mean, again, we live in a very like small existence, right? Like we're all in this dental universe, and within this dental universe, I exist as some figure.
Mm.
But in the real world, I'm actually, you know, I'm among my friends, I'm among my people. Where I live, I have a little bit of notability because I have a
Yeah.
business that treats so many people, but I'm not like, I don't walk around with this sense that I
No
have
one's asking
some
if you're
level of
autograph in
fame.
the streets.
No, never, not once. But I will tell you, it's great for me if I'm sitting with one of my
Yeah.
kids at a cafe or a restaurant or whatever, and someone's like, "Oh, Dr. Auerbach," you know, and the mother's like, "Oh, you took my kid's wisdom teeth out. It was such a good experience." And you know, it's a nice thing for me. Very few people, although sometimes, but very few people come up to me like, "Holy shit, bloody tooth guy, you're the," you know, like
Guys, if
that
you ever
doesn't
see
really
Jason
happen.
out and about, please just go unnecessarily insane around him just to see how he reacts, and have someone video it around the corner. I think it'd be hilarious.
Right. I will tell you. So, to kind of piggyback off what you were talking about going to Chicago and having X number of people in the room, 40, 50,
Mm.
whatever it was, um, DIA 2019, there we were in, I think we were in LA.
Yeah.
Scottsdale was the first one. So we were in LA, and I spoke. I actually was when I came out, if you will, right? That people relieved, like, identified myself as Bloody Tooth Guy. And there was a line of people at the end of that presentation where Ben introduced me, Ben Johnson, PNW OMS, where he introduced me, and they wanted like selfies with me, and it was such a surreal experience for me because again, I'm a dentist from New Jersey,
Yeah.
and it's you don't have that kind of notability. It's great. It was, I love it.
It's a bit of fun.
I
It's
love
a
it.
great bit of fun, isn't it?
It's very, yeah, I do love it for sure.
Is New Jersey the one where they say coffee like coffee? Is that the place we're talking?
Coffee,
Oh, there's no W.
coffee.
Where's coffee?
No, coffee's probably like
Okay.
Massachusetts, like Boston, like, you know, that area up there. You know what the fun? I'm not from New Jersey, and it's still sometimes. Well, I can't say this out loud, but it was for a long time difficult for me to say I'm from New Jersey
Right.
because I'm from New York, and
Is this a
I
real
love
thing?
that.
Because I've watched, like New York TV programs, and they're like someone's dating someone from New Jersey and or Brooklyn across the Brooklyn Bridge, and it's just like, why are you doing this? It's terrible. You might as well find a homeless person in New York. It's much better for you.
Right? Yeah, New Jersey gets a bad
Yeah.
rap. I mean, it does. It did when I was growing up. It still does. I will tell you, New Jersey happens to be a beautiful place, a great existence, and I mean, I'm right now. I don't know if I said this. I am like 6 miles from Manhattan right
Right.
now. So it's green. It's beautiful. Everyone is, and not everyone is nice, but people are nice to one another. It's communal living and whatever it is. But it's right by the city. I'm in the city. Well, not right now because it's
You're
crazy
close
there right
enough.
now. But I'm in the city routinely,
Mm.
2, 3 nights a week. We dine there, see shows, music. I go to see
That's the
games
best
there all
part of
the
the
time.
city, though. You
So
probably don't want to live in a pokey little apartment where your bathroom is within your bedroom. Or
right. Well, you don't want to, but there are trade-offs. I
mm.
mean, so we lived in the city, my wife and I, until our second daughter was born, and it was everything we ever needed. It was great. And then we move out here. We've got this house with the land and the, you know, everything. And we all ultimately were planning, and I think still are planning on going back to the city once the kids are done and all of that. But we'll see. Things in the city are very, very difficult, very different right now.
Yeah, I
Very
can
different.
imagine things
Yeah.
have changed around multiple
Yeah.
times in the last year, even a year alone. So yeah, I can imagine.
Yeah.
Uh,
For sure.
is an interesting one. What's something that absolutely nobody agrees with you on? Anything that you say and absolutely nobody agrees with you?
Um, No, I find actually the biggest, for me, the thing that people don't agree with me about is probably when I want to acquire another practice that they think is like ridiculous. Right. What do you need that for? Things like that. I like to, I like the kind of I don't want to say the game of it, but I like to kind of figure out how to make something work and put it as a part of like a piece of the puzzle that I'm looking to actually. I have these very significant long-term goals, and I see them and I understand them. Not everybody who's around me does.
The grand vision of it, yeah.
Exactly. So, I mean, they understand, they perceive they understand, but they don't really understand what I'm,
really
how I see it fitting in. Maybe it's my weakness not being able to communicate it, but that's something. People are like, why do you want to buy that practice? That's ridiculous, or whatever it is, that kind of thing.
Yeah, it's something I spoke to someone recently about, not on air or anything, one of my friends. He's actually coming on the podcast quite soon. He's a young guy, early 30s, and he was working in Australia, and then the opportunity to open a squat practice up in London. You know, amazing opportunity.
Squat meaning like satellite?
Like a single surgery. So they call a squat in the UK a single surgery site, which you then try and expand. So then he had this opportunity, and then by the time he came over back from Australia, you know, he'd got another friend in, so they ended up opening up a pretty nice place. But it's the same sort of thing he said to me, you know, it's
I'm so sorry about that. I don't know how that happened.
I think we're back. Guys, just let me know if Jason's back on screen. He should be. I've just checked. We've got a couple of questions, actually. I don't know where I lost you, actually, on that little chat. Dr. Awu was asking if you can do some demonstrations of hand suturing in a video at some point.
So let me actually speak to that, because I'm asked that. I don't know. That's probably the thing I'm asked more than anything else. And I would like to do that. That's why I need somebody who can record it and edit it and do whatever. Because for me, tying the suture is nothing. It's just a matter of turning it into content that people would want to consume. I do think that would be a great little piece of information for people, but it's not, for me,
you need that
easy
PCS.
to produce.
That PCS to come in.
Yeah. I do.
Awesome. And the other question or comment we had was from Clevis. Thank you for the comment. Dr. Jason, I've seen that the teacher that been looking for a long time, more tips and great energy that helps us to improve. So just a really nice comment there from Clevis. Thank you, mate.
I appreciate
it. Yeah, so he what was I talking about before we got cut off? It was something to do with my friend's practice. But
squat
that's
practice.
The thing, yeah. We were saying it was the same sort of idea. That he's got a vision for how he wants it to go. It's not an easy time at the moment with everything that's going on. You know, COVID's. You know, everyone's moved out the city for a start in London, so that really hit them guys. But I said to him, look, is it kind of like a game in that, you know, if you play SimCity or Roller Coaster Tycoon, do you have that idea of I've got to look at these balance sheets that come up on the screen and work out where I'm hemorrhaging money and where I can improve and optimize things? Is that how you see it in your head?
You know, I would say it is like a game for sure, but it's the game. It's real life, right?
Yeah.
So, you know, the scorecard is, I think, your internal fulfillment, and then, you know, your success and however you base your idea of what success is. If it's more time with your family, more time to travel, more money in the bank, more toys, whatever it is that however you judge it. But for me, it's funny because I'm at a point in my life where it's changed from like, I want to make a lot of money to I want to have this thing that's bigger than me. And so, I mean, kind of my history is I started my practice in the office that I'm currently sitting in in 2007. It was me and 3 of my team members who are still with me today. And now we have 6 offices, 8 surgeons, 54 employees over, you know, basically the state of New Jersey. And we've become the official oral surgeons for the New Jersey Devils, which is an NHL team, you know, professional hockey. And we're a, you know, full scope oral maxillofacial surgery practice, and we're just growing. And so for me, I love it. I love that side of what I do,
Yeah,
for
and I
sure.
think that's really telling that, if someone else, other people who maybe were at that level where you were owning six practices, got all these guys working under you, it's quite telling in a way that you're still working day to day, because a lot of people would say, this is perfect. I can now not do clinical. I can just go off and I don't know. There's a thing about dentists in the US playing golf all the time, isn't there? So there's
Right.
all these things that you could be doing, but you genuinely love the profession and specialty that you went into enough that even though everything's going well and you maybe don't have to, you're still going in and smashing it.
Yeah, I love it. I wouldn't change it. I mean, as time goes on and I get older and I maybe get more tired or whatever it is, then maybe I pull back. But yeah, I love doing it. I really do. And I will say to you, you find guys who get on in their career and then move away from the hands and the eyes and doing that type of
Mm.
stuff, and they slow down a little bit. You got to stay. You got to stay. I don't know if this is like an American attitude or my perspective or whatever, but you got to stay in it. If you like the moment you just like stop and start just doing nothing, your brain is garbage and you're done. For me, always do stuff forever. I don't think I'll ever
Yeah,
stop.
what I think even if you are someone who stops doing clinical, for example, if you've got another project that you think you need to complete, to have that satisfaction, I think it's really important to get along with that project, because you're right. I think you see a lot of people, as soon as they fully retire, things start to go a little bit south pretty quickly.
Oh
And
yeah,
there's something about keeping your mind occupied and your body occupied that is really, really important.
for sure, for sure.
A couple more questions. Do you ever get on call for the New Jersey Devils after games from injuries?
Uh, it should suffice to say that we've treated a fair number of Devils for injuries sustained in
Yeah,
games. Yeah,
I
for
think
sure.
I'm not
Practices,
surprised there
games,
at all.
whatever. Yeah. I mean, yeah, I will tell you the interesting thing is hockey players, generally younger guys, right? And most of them, when they have facial or oral injuries, you fix the acute issue, but they don't go for the reconstruction while they're still playing.
Mm,
So a lot of the stuff happens after they've retired from the game. If you have your forefront teeth knocked out, yeah, we suture them up. We maybe do some bone grafting or whatever it is, but they'll wear a denture or whatever. They're not going for full implants because they know 6 games later they'll get hit in the face with a puck. So it's a whole different
yeah, you don't want to
thing.
be swallowing some titanium. That'd be really fun. It would be great.
True.
Docker, we were saying, do you lecture as well, and do you have any literature out?
So I I don't really lecture, and the reason why I don't lecture is
What we spoke
because
about before.
I don't. Yeah, I mean, I'm not one to prepare slides and do that type of work. I mean, I'm happy to always be in this type of venue without preparation or whatever, and just talk and talk about anything. But I'm not a lecturer by nature. I do think I need to hone that skill set. I really do think that that's something that I actually have to work
Mm,
on. But I don't really love doing that. And I think again, just to kind of beat the dead horse, like I don't have to
yeah.
do that. So, and it's true. I work with certain companies. I have relationships with certain companies, and as Bloody Tooth Guy and as Jason Auerbach, and they want me to talk. They want me to do certain things, and it's just like I established from the get go. That's not who I
Yeah,
am.
yeah.
Like, it's not what I'm
I
gonna
think
do.
it's not for everyone for sure. I mean, I was asked to do some social media lecturing at a conference in Manchester. It's actually this year. It feels like 2 years ago. But yeah, it was back in, I think, February time, and I didn't prepare slides, and I don't think the students enjoyed it because they were there with their
Right.
notepads, and I was like, "Yeah, there's no slides. We're going to talk. This is social media. We'll be social." And they really really struggled because they were thinking, "Going to come in. He's going to have slides up, and it's going to be a how-to." And I gave them broad overviews and themes and ideas we could discuss between each other. And I couldn't do that in a lecture theatre. This was like a seminar room, with I think it was 15,
Right.
20 guys in the room, and I was kind of in the middle talking, getting them to come up with answers and stuff like that. I think that's something that I preferred. I think they really, really didn't like it. So it's one of those things that um, it's only for some people. I think it's not for
Yeah.
everyone. And there were some guys that responded really well, and some guys that just looked really disappointed when I turned off the projector.
Right. Well, I mean, I will say that a lot of people out there are looking for an answer. And I think that if you're opportunistic, you can take advantage of that fact,
Mm,
right? So, a lot of guys who have these continuing education courses or coaching or things like that know that the average person maybe is not going to be able to implement what they've been able to kind of put out there. So even if you give them the
not
instructions
gonna
on
do it.
this is how you become
Mm,
successful, like you have to know who you are and you have to know what you're capable of. And I mean, that takes a lot for a lot of people, and that's totally fair.
yeah.
But I don't know. I think a lot of people look for answers, and even like with exodontia, right? I mean, people ask me like, "What book? What book should I read to take out wisdom teeth?" And it's got I don't think I ever read a book ever once on how to take out wisdom teeth from the time that I was training. Maybe in dental school there was an oral surgery textbook or
Yeah.
something like that that we looked at, Peterson or something. But the fact is like you do. I mean, I trained as an oral maxillofacial surgeon. I took out 25,000 wisdom teeth over the course of the 4 years I was in
Wow.
training, and probably another 25,000 since. So for me, it's about honing, understanding, learning by doing. You know, you learn by doing, in my
Do you think
opinion,
this?
by being trained well.
Yeah, I agree with
Go
you.
ahead, I'm
Do you
sorry.
think there's any benefit in someone who's already passed through dental school going around and shadowing? Because I get this asked a number of times. You know, can I come and shadow you? And it's by people who are, or not me, but are there any opportunities for shadowing that you know of and stuff like this from actual qualified dentists and things along those lines? For me, it doesn't really make sense. it it's surely your hands need to learn that neural pathway of doing something and learning it by repetition, and then you using your mind to understand limitations and nuances and how you're doing things and when you can and can't do something.
So I actually think shadowing as a first step is a very good modality, because you can't read something in a text and understand how it actually converts into real life, in my
Right.
opinion. My brain doesn't work that way. So in residency, there's this concept, and I'm sure everybody knows this, is a see one, do one, teach one. So you observe someone doing something, then you perform it under guidance, and then you can teach the next year guy how to do it. And at that point, metaphorically, you've completed understanding how to do something,
Yeah.
because if you can impart that knowledge to the next person, you clearly understand it, you can deconstruct it, and then
Yeah, you just
regurgitate
got to
it,
wait for
right?
their exam results.
But right. But for me, I mean, I do have people. I had someone here the last 2 days, a guy who is a resident. He's in
Yeah.
training, and he came to see me from across the country. He's training in California. He came to see me because he's watched me do what I do and he wanted to see. So if you're in the room with me, and it's not just the stuff I'm putting out there with the cut up videos and stuff like that, it's you're watching me perform the
Mm,
procedure, a patient sedated, and I'm talking to you about why I'm doing this, or how my hand, what I'm thinking, and if there's a complication, how I move to the next thing without even thinking. Um, I think you do benefit from. I really do think you can benefit from observation, but it has to be put into practice. Like with anything, we hire a consultant to teach us business or systems or whatever it is we're trying
yeah.
to do. It all can make sense, but until you put it into practice and do it repeatedly, you
Yeah.
lose the
Yeah.
skills. I mean, for sure.
Yeah, I think that makes sense. I'm kind of playing devil's advocate a little bit. I do think repeated, going and shadowing something and never doing it is going to be a complete waste of everyone's time almost. But I think you're definitely right. That
Sure.
repetition and then um, teaching it afterwards really, even just explaining to, your mate who's also a dentist might be a good way of working out whether you understand it well enough.
For sure.
Loads of questions, guys.
For
Thank
sure.
you. Um, advice for first time suturers?
uh just do it a lot. Again, like anything else, when I was in training, everyone asked me how to hand tie. How do you do that hand tie? How do you do the hand tie? I mean, I literally sat there in my resident room every day, every night. I'd go home with 3O silk sutures. I'd suture my scrubs. I'd suture, like, meaning just on my
Yeah,
pant leg. I'd suture whatever I was suturing, like my sneakers, tying my sneakers. I would just constantly do it. And, you do something 10,000 hours, you're going to be an
yeah.
expert at it.
It's that kind of building up experience. That's why, if you send something to a guy who's just finished, for example, we'll go back to endo because it's my thing. Someone who's just finished their endo residency, he's going to be much better than someone who's finished dental school. But a guy who's been practicing 20 years, he's going to do it much, much quicker. He's not going to have to think so hard about what he's doing. Unless his eyesight's failing or whatever, then there's other things that come into play. But it's that whole master kind of learning pathway.
Do you know who Jason Deblinger is?
I've heard the name. I can't
Yeah. So
remember. I can't. Yeah, no, he's got like a tooth as his profile picture, right?
maybe, I don't know. I'm not positive, but I will tell you he's
Mm,
exceptional. He's in New York City. He's got, I think, 4 practices in Manhattan, maybe 3 in Manhattan, 1 in Brooklyn. Um, and he does things with endodontic treatment that I almost don't believe it. If he wasn't my
yeah,
friend, like, I know him, I've sent patients to him and him to me, I would never think the stuff was even
possible. Mm,
realistic. Anything he puts up there, I'm like, just extract it, extract it. Not because I'm philosophically about just taking teeth out, even though obviously, but I mean, it's just some impressive stuff he does. So
yeah, I mean,
check him out.
I'm pretty sure I'm following. I'll check him out afterwards for sure. Oh, another question. Thank you, all the way from Ireland. What's your IV cocktail?
Okay. So I mean, my cocktail consists mainly of vodka and ice, but let's talk a little bit about what I do intravenously. Intravenously, I usually start with 3 milligrams of Versed,
Yep.
midazolam, 50 mics of fentanyl, and typically 20 milligrams of ketamine, and then depending if I need propofol, I use propofol. If you watch my stuff, most of my patients are under moderate
Okay.
sedation, mild to moderate sedation. And so I love being able to converse with the patient. A lot of people don't want that. They want their patients zonked,
Gone.
and that's totally fair. I prefer knowing that I can get good local and having the patient have the right expectations. Plus, I practice in a suburban area. People are generally accepting of my perspective, and so I think that for me, well, not I think for me, that's what
Yeah.
I use. 350 and 20
I think
typically.
this is a contentious issue in the UK. We don't tend to sedate quite as readily as you guys in the States, and we don't tend to take eights
You're
out
right.
as aggressively, almost, as routinely as you guys do. Why do you think that difference exists, and what's your position on more or less routine sedation? For example, I had my eights out by a really, really talented oral surgeon, Dr. Dalgoose in Leeds, and mine was straight local. There was nothing else going on there. I did try and video it with my phone, but it wasn't particularly easy. But
No, I'm
what's your
sure not.
position?
uh I think so. I'm not a hard and fast, everyone needs to be sedated guy. A lot of people are. They won't even do it without
Mm,
sedation. For me, I do believe it is more comfortable for the patient. It is. I mean, there's no question about it. And when you do it and you do it a lot, it's very
yeah,
safe and it's very effective. I mean, again, people who watch my sedations, they see my patients are responsive to me. If I ask them to turn their head, they do. If I ask them to open wider, they do. If they're feeling anything, they'll tell me. I'll accommodate that, more local, whatever it is. I think it just makes for a more pleasant experience. I mean, we could debate the difference between Americans and the rest of the world and what we do and why we do it and all of that, but it's really makes for a much more comfortable
yeah,
situation. It's like I'll go to Europe, and I'm in France. I'm in the most beautiful hotel in Paris ever, and like I get in the shower and the wall is open, just like a little bit of glass on the wall, and I'm cold, and I don't understand that. Like, why wouldn't you have a door that
I'm
closes?
with you.
It's I mean, like, it's better. It's better. Why not? So, in my opinion, it's better to be comfortable and
Mhm.
sedated than it safely, of
Yeah, yeah,
course,
no, of
than
course.
it is to be awake and feel those injections and the pressure and like the sounds. A lot of people they don't want that. So, if you have the opportunity to have a better
Yeah.
solution,
Do you
you know,
just going back
my
to that? Do you
opinion,
have a favorite sound, oral
sound.
surgery related? You know, I don't know. Is it like the crack of a or something or
I do like so if I take out some
yeah,
granulation tissue or part of the follicle and I'm holding it in my rongeur and the one of my assistants like suctions it up. I like that sound. It's a sonic branding. That's a Gary V thing. But I do think that's a good sound
I
for
need
me.
to get some. I think
Satisfying.
I need to get a catchphrase that I roll in with. Actually, thinking about it, you know, on the Gary V side. But I always liked, you know, when you just about looks it and you're bringing that tooth out and you hear the little. I can't even do it. You know,
Yeah.
the little pop that means okay,
Yeah. Yeah.
you're
Sure.
clear, you're home free. I
Oh
quite
yeah.
enjoy that within the oral surgery stuff. Yeah.
For sure.
What is it you love about Gary Vee actually? Because I've been watching quite a lot of his stuff as well, and well, obviously you've been to one of his events. What is it that was so magnetic about that guy? Do you reckon?
So I think um I don't want no negativity. So I think when I first saw Gary V, I was attracted to his kind of direct, just like in your face nature, and he's a very pragmatic kind of
Yeah,
guy. And in my opinion, and I don't know if this is my narcissism or what it is, but for me, when I see a guy who has attained a certain level of success, that I subscribe to the same mindset that he or she does. Um, to me, I just like that person more. So maybe that's a psychological thing within me that we can explore if you'd like.
sure.
Um, but but Gary, I feel like he has over and over, time and time again, shown that he has a sense of social media marketing, that he understands it
Mm,
like on a very very basic level, and he understands it. He understands the psychology of the person receiving that information. His story is great. I mean, like the child of an immigrant, he comes here, the wine library, the whole story is great, and then he turns it into this. I mean, the fact that he's a Jet fan is ridiculous to me. The Jets are horrible and always will be. But um but but I happen to respect him a great
yeah.
deal. A great deal. Yeah.
He's almost on the same sort of plane as another one of your New Yorker friends, Casey Neistat. I don't know if you've seen much of his stuff.
No, I haven't.
He's a
I
guy
haven't.
that took vlogging and videography, which were previously two very, very separate things. You know, that cinematic style, very top of the line, almost Hollywood level cinematics. And this is what I'm doing today. And he married them together for the first time on YouTube, and everybody's doing it now. Absolutely everybody. Everybody's trying to like take a spin on what he's doing. Even myself, maybe, you know, with Dents of Insta, there's things that I'm thinking of that, you know, once I work out how to do it, I'm gonna maybe try, you know, daily vlogs of this is what I've done today, but in the most cinematic way possible. You've got the issues of, you know, patients, are they happy to be on video and camera and stuff like that? So you need to think about that kind of thing. But it's the same sort of thing, you know. He's someone who took two very different and good in their own right thing and made his own niche and his own thing from it. And I think Gary Vee is exactly in the same kind of vein.
Interesting. I'll check that guy out for
Yeah,
sure.
he's the guy that did the review of the first class cabin with the drone. I don't know if you saw that video.
I haven't seen it.
A bit
I haven't
ridiculous.
seen it.
I don't know how he got them to let him do that, but he flew a drone within a plane. Yeah,
Really.
nuts.
That's great. I'll tell you who I think who does. I mean, not nearly that, but who I think has a really good understanding of it in the dental world, is Appa.
Yeah, wow.
Michael Appa. He's done a really incredible job of creating a lifestyle brand and almost creating himself as like a celebrity dentist, not treating celebrities, but himself as a celebrity. That's impressive. It's very impressive to me. And whatever people think, there's a lot of, when you get to the level of an app, people want to bring you down. People want to say negative stuff and whatever it is. But I think that what separates successful people from those who may not be are you respect other successful people. Like I respect what he does. His hustle is amazing. And again, I like the Brunello Cucinelli. I love to fly to Dubai in a first-class cabin on Emirates. I'd love to have a clinic in LA and Dubai and New York City. I think the lifestyle part of it is part of the allure for his audience. I think he does a good job.
Especially with
quality images.
It's the cosmetics is all how everything looks, and then he's taken how everything looks with your teeth and gone, okay, clinic, Nano Life, how I get places, just the whole way through. He's gone, everything is gonna look seamless, and he's apparently someone that I interviewed right at the start of lockdown, someone who did the master's program with him in New York, said he's a lovely guy, just loveliest guy you'll ever meet.
So any interaction I've ever had with him, patients back and forth and whatever, has been great. And it's funny, he's a kid. He went to NYU dental. I went to NYU for dental school. He went to NYU dental school. When I say kid, he's a handful, maybe 10 years younger than me, 8 years younger.
He's a child,
but he's great. I mean, the practice that he joined was, I don't know if you know the name. I'm sure you know the name Larry Rosenthal, especially if you watch Appa's stuff. Larry made veneers what veneers are in New York City. I mean, he really was that influential in dentistry in New York City in 80s, 90s, 2000, whatever it was. Tremendous, built a tremendous practice. And then Appa really took that to the entire next level. Amazing stuff. Really impressive.
Yeah, I honestly, the stuff he brings out with, I watched a couple of the quote unquote webinars. They weren't really webinars. It was just him showing us some pictures of patients, and the level of detail he likes to go into was just really, really kind of mind blowing for me, and really inspirational. Even though I have absolutely no interest in doing cosmetics, I was like, wow, you are something special, really. And it's one of those things. And what I really liked was he never once, hid the fact that he had to work exceptionally hard to get there. And it doesn't leave that kind of, because in the UK we have this thing of new grads are going doing Invisalign and a couple of composite courses in the first year of training, and they're trying to do veneers like day one, which makes no sense. You don't really know enough to go ahead and do something like that. So I like that he goes, look, it took me 12 years. So yeah.
That's right. Yeah. I mean, that's actually an interesting part of the whole social media equation, that a lot of people look at people who have been doing it for as long as, I'll put myself in the category we have, and you think it's like, okay, how do I do that? Or I want to do that. It took many years to be here. And, nobody sees the grind. Nobody sees it. I'm sorry. Again, people are trying to... Do you see me?
Yeah, we got you.
All right, hold on. Oh, there you are. I'm sorry. Nobody sees the grind. Nobody understands what happens behind the scenes, because everything's curated, right? And you're only kind of getting bits and pieces, but there's a lot that went into it, for sure.
Yeah. Talking about the grind, what do you think?
Yeah.
Is there a certain extraction that you remember that just gives you the sweats and you go, how the hell did that happen to me, and why was it so difficult? Thank you for the question, Diamond Joe.
So I trained down in Brooklyn. I trained at a hospital. The primary hospital I trained was called Kings County Hospital. It's part of SUNY, State University of New York, Downstate Medical Center. So it's in Brooklyn, and the teeth down there were very, very challenging at times. And again, I was in the beginning of my career. So there's a lot when you're starting to take out teeth and you think that there's a lot of force involved and it's all about just like brute strength and stuff like that. And you learn that in those most difficult, most dense bones of big roots, bulbous roots, divergent roots, you learn it has nothing to do with strength at all. It's everything to do with technique. So you learn patience, you learn like, the subtleties of doing these types of things. And you also learn not to beat yourself up and maybe take a step back and kind of come back with a new set of eyes. So there were many teeth that humbled me back then. And frankly, still today, there are situations that are humbling that you just kind of like, wow, why would this take so long? Or I can't believe that. I mean, that happens. That happens even today.
Yeah.
There was a wisdom tooth that I was put. So people don't necessarily know this. I post cases as they're occurring, right? So I'll take Natalie, Nana, and I'll say, do me a favor, video this or whatever it is. She records it. She's recording the whole time. So thankfully, most of my cases go very smoothly, but not
Yeah.
all. There was a case, a wisdom tooth I did, lower left wisdom tooth I did maybe, I don't know, a week and a half, 2 weeks ago that was miserable, and it came through. And so sometimes teeth humble you. That's okay.
Yeah.
Nothing wrong with
It's
that.
medical treatment. There's no guarantees at the end of the day.
Right. Right.
So yeah, I think that's pretty fair. Yes, guys, hit the like button. There's 13 views, but only 7 likes. Thank you, Dr. Aru, for, as always, running the comment section. Has there ever been a patient that really kind of touched your heart and like affirmed what you were doing?
There are many patients that do that. I've been asked about this. The most memorable patient situation I had was a young kid who was from Jamaica and had some traumatic injury, fractured his left condyle, and went back to Jamaica and ended up with ankylosis of the left TMJ. So he was young, but he was malnourished. He could not eat, and he was very, very small and very weak. And so what we did was we harvested a rib and we reattached it. We removed the ankylosed segment, and immediately he was functioning.
Wow.
And he went on to thrive, and he was great. And that was for me the most touching, by far the most touching experience. It will live with me till I'm done, meaning done with the whole life thing. So he was probably definitely the most touching for sure.
Yeah, I think those ones where there's a bit of a bit more to it. There's more of a story there than my wisdom tooth hurting. That's always something that's just gonna stick with you a little bit more.
Yeah,
For sure. There's in my very short career, there are a couple of cases that I can think of where something similar has happened and someone's come back and said something. I've given an immediate denture and they've gone out and put lipstick on and gone and bought new clothes and all sorts of things. So you can make such a huge difference, which is a lot of the reason that we get into healthcare and teeth in general.
No question about it. I mean, the fact is dentistry. I mean, if you watch me, I believe oral maxillofacial surgery is by far the best specialty in any medicine, dentistry, period. There's no question to me. But I would say really the most special thing is you really do make a difference every single day. Every single day, you're able to change someone's life for the better. Something small like pain or like a little dental infection, all the way up to, some sort of procedure based on pathology or trauma or whatever. I mean, it runs the gamut. And I think that we're very lucky and we shouldn't take that for granted.
No, totally. Tell me about your steak last night, actually. We've got some steaks downstairs
So
I'm ready for.
So I will tell you that steak was from a patient of mine who was appreciative. He's a like not a butcher, but he's a meat distributor. And so he came by to thank me. He brought me, that was
It was sirloin.
I don't know if it's like a 20-ounce ribeye cowboy cut or whatever it was. And then he brought me a bunch of other steaks that were not featured. But honestly, it was great. It was perfect. And I just threw it there. We ate it right off the counter, not like the counter, but the whatever I cooked it on. And it was great. I mean, perfect steak for the end of the
There's
day.
something about steak that's just, so satisfying, especially when you cut into it and it's just that little pinkness and soft and melts in the mouth. And I didn't really get the melt in the mouth thing till I had a steak that was really well marbled. And I was like, now I get it. And before I was just like, oh,
Yeah.
these guys on TV, they're just talking nonsense, and it's like, you know, when people are smelling wines or whatever, and they're saying, oh, I can smell walnut and this and that, and
Yeah. So, I mean, talk about wine. I'm very into wine, Italian wines. But when I started getting into wines, I said to this guy who was helping me kind of find my way, I said, listen, I love wine. I can't identify what about this wine I like or I don't like. So let's try to like hone that. Let's try to figure out what I like. Give me a selection of wines and I will drink them and I will tell you what I like. And then from that, we'll find other wines that have similar characteristics and we'll move on. And I actually learned about wine that way and the types of wines that I like and all of that. But yeah, I mean, there are guys out there who are like, I don't know if you've ever seen Sam so Sam was this, it's on Netflix. It's this amazing documentary of going through the like confirmation of the sommelier process. And I will tell you, there are guys who literally can smell and taste all those things. Me, I'm just like, oh, that's good. It smells good. It tastes good. I'm into it. So
disclaimer:
yeah,
I don't actually drink. In case people are wondering what's
fair
going
enough.
on, but yeah, it's that same sort of idea, of are they talking nonsense or is it something real? But yeah, it's really really great, especially when you come back and you've maybe had a big gym session or something, which of course is really important for you dentists out there, keeping the backs and necks strong. Although we don't need it for oral surgery, all right?
That's right. Actually, I will tell you, this is another thing as an old man, I will say that if you treat, and I haven't been doing this through COVID, but if you treat your body well and you realize that you are performing physical
Mm.
labor every single day and have to look at yourself almost like an athlete in that way, you want longevity in your career and you want to be healthy long term and you want to be able to provide the best care and take care of yourself and walk after you're done practicing. Um, Take care of your body because there's the knees, the hips, the back, the neck, whatever it is that's ailing you, you only get one shot with that stuff.
Yeah,
So
yeah.
take care
How
of
are
it.
we doing?
I mean, you're a young guy now, and you're like a fit young guy. You'll be fine, no concerns. But
I'm trying.
people out there need to take care of themselves for sure.
How are we doing for time? Do you have that meeting to get to? Are we still good?
The problem is that I put my phone, I thought, on do not disturb, and I've been disturbed, so I don't know. I don't even know. I mean, I'm not too worried about it. It'll be fine. We can go for a little
Right,
run.
sweet.
I'm
Yeah.
fine.
If you need to go, just shout me because I'm happy to call it a day whenever you are. If you have to run. Um, but yeah, I think that's really interesting. Um, can you tell me a bit more about what this year has been like for you? We've had, you know, half of the West Coast on fire. We've had presidential elections. We've had COVID merry-go-rounds. We've had protests. How has it affected where you are and the way you do things? How the way you see things?
2020 has been kind of a mixed bag, right? It's been a shit show on the
Mm,
outside, but it really has been. It's so in March, the middle of March, I went and I saw a concert at Madison Square Garden. I'm a big music guy. I see music. I saw music weekly. So I saw a concert at Madison Square Garden on March 10th, and shortly thereafter, everything changed. Obviously, I was very fortunate because of my position on Instagram to have had kind of a little bit of a heads up. So professionally, like a lot of guys out here were a little bit like
yeah.
blindsided by how quickly and how bad it came. But I was talking to people in Italy and Spain well before it was as bad as it was here, and so we were prepared. We were prepared with
PPE, yeah.
PPE. We were prepared in terms of getting the word out. Our referral base has only grown. Our opportunities have only grown. So from a business perspective, while for the first month and a half, 2 months, I was very, very concerned that what I had built from nothing was like going to all crumble and the world was over and all that stuff. We have been there. My team has really answered the call, so we've been very, very fortunate. It gave me opportunity to have dinner with my kids where I hadn't
Yeah.
really been doing that a lot prior to. That was a really positive. It gave me opportunity again to go back to the professional to acquire practices and to make connections and to meet more and more people and to expand on Bloody Tooth Guy. So it's been a net positive
Yeah,
professionally,
in that
I
particular
believe.
segment of your life.
Yeah,
Obviously, we
exactly.
know, guys. You know, if anyone wants to get triggered or anything, COVID has been awful for many people's lives and livelihoods and things like that. We're just talking about a very small section of what's your personal experience and lived experiences.
Absolutely. You know, we have I've had very close friends who have gotten
Mm,
COVID, who have had very terrible experiences with it, and it's been a tremendous hardship for many people. So yeah, I mean, not to be insensitive at all. That's not my nature. It's been terrible. It's been terrible for my city, right? New
was
York
it really
City.
hard? Yeah.
It has been hit really hard. I mean, dining and entertainment, which is everything in New York City, um, is all but basically gone, and continues to be. I have friends who are in the restaurant business and who have had a really tough time and who continue to have a
Mm,
really tough time, and you know, coupled with the political climate, things are not so great. I mean, I've been very fortunate. My life is still by almost anyone's standards
yeah. Great.
spectacular, but but it's definitely different than it was. I mean, it completely. That's what it is. I mean, talk about like forget the fires, and I mean that's
Yeah.
terrible. Yeah,
I was
the
just setting the
whole the
scene. You know,
whole
of 2020 is a bit of a
yeah.
nightmare.
I mean, the it's been. I mean, it's been really for me the biggest issue is the political divide in our country, which is horribly
Mm,
terrible, which is not really the right way to say it, but that's how much it upsets me. The political divide on both sides of the aisle. The polls are. I don't mean the presidential polls who's going to win. I mean the polar opposite viewpoints are so loud. Whereas most people just want to live
somewhere in the middle.
more or
Yeah.
less in the middle and just kind of exist and be happy and love each other, and you know, like all the people who are on the exact extremes are really just creating problems. And um, and the COVID and the fact that COVID has been politicized is crazy to me. Also, I mean, whatever you feel about Donald Trump, I mean, the guy's. I'm not going to go
Yeah.
into it, but whatever you feel about Donald Trump, like this is a worldwide pandemic. Obviously, everyone should wear masks. Everyone should respect each other. Everyone should do the right thing. But I don't think like I just think it's
We've had
I
the
think
same
it's
thing here,
the
to be honest.
politics.
We've had exactly the same thing in the UK. You know, um, nonsensical decisions by people in power, and most people can
Right.
see it. And you're just going, why have you done this? We could be over the other side of things if you had, you know, done something slightly different. There's so we have the Conservatives, and I don't mind saying this because, you know, whatever. There's PPE contracts going to people who have donated things to the party who have never sold PPE in their lives. You know, we're talking 3, 4, 500 million pounds worth, just like that. We know, with no tender, and it's just that kind of thing where you just go, well, are we trying to stop this, or are we trying to get a bit of a cash out of the public purse and stuff like that? So yeah, I can see your point. You know,
Right.
there's a lot of really crazy things going on, and it's not my lived experience of when I went to the States. You know, everyone I met in the States was lovely, and if you watched the news, you're just like, wow, they're about to go into civil war. You know, there's guys with guns running around everywhere. Although I did hear gunshots in Chicago,
Right.
so I will say that. So that was a bit scary, but it was a good far distance away
Yeah.
from us.
You know what though? You hear like that's the problem with the news. Again, on both sides, the news shows all this like crazy stuff that's I don't there's no guns around here. No one's having a
Yeah,
gun. There is no guns. I mean, do you know how difficult it is to get a gun around here? I mean, anyone who has a gun is probably having a gun because of their maybe military background or whatever it is. I mean, maybe I shouldn't say this, it come to my whatever, but the guns are not like a part of the everyday existence of the people with whom I
yeah, yeah.
share my time, right? And I just think it's just the way that things are painted, and I think the fact that you really can't say anything without being judged for it, and on either
Yeah,
side,
yeah, yeah. I've
it's
seen this whole
just
thing about
it's
cancel culture, and it's just, you know, almost insane. And there are things that I disagree with as an outsider on both sides. And like
Right.
probably most people, you probably want to land somewhere in the middle.
Right. I mean, that's the thing. You go around if you travel the world, you meet people from every corner of the world, every culture, people that you've been told are bad or are against you, and you meet them as an individual human being. And most people are just like normal. They want to talk to you or whatever. I mean, it's such a
Mm,
shame that there's like labels put on different groups of people for really no other reason. Like everyone should be treated equal, but these people are monolithic in their thinking. Everyone should feel this way, but again, I'm like
yeah.
speechless because it bothers me
No, I
tremendously.
know what you
Yeah.
mean. I mean, I've been to in most places that I've been to. I'm very lucky that I'm fairly well traveled, not as well as some, and probably more than a lot of people. Everywhere I've been, people just want to feed you. This is it. They
Yeah.
just want to give you food, and I
All
think
right.
that's the
Well
energy you
said.
need to take within you wherever you go. Just like try that food, try this food. It's all good. You were all friends. If you have differences in opinion, don't let it overtake your relationship with someone. And it's all gonna
Right.
be good.
Yeah, yeah. I think that's great, and I actually love that statement. I'm going to use that in my world. I think that's
Which
great,
one that everyone
and
just
it's
wants to
true.
feed you?
Yeah, everyone just wants to feed you, and that's actually realistic and
Mm,
literal, and it's also metaphorical, right? They just want to feed you with goodness and happiness and love, right? They want to feed you, but they also want to feed you like this is what's so great about our culture, or this is what's so great about our
look how we
country,
do
or
things. Isn't this cool? Yeah.
exactly. Yeah, yeah. I think that's great. I love that.
Yeah,
I think
that's
that's well
honestly
said.
wherever I've been, I can't think of a single situation where we were unwelcomed by the people who were, indigenous or of that country. It's always been try this, try that, go here, go there. Have you seen this? This is how we do this. This is how we do that.
Right. Right. So right. Most people are good
Yeah,
people.
yeah.
Period. Right.
That's yeah. I don't think there's much more to be said around that really. Um,
Right.
yeah, it's just an interesting world we live in. I think.
I just hope it swings back to a point where I don't know if this is just like me being an idealistic or a human being or whatever, but like it would be so great if we could just get to a point where it would be a little more
Mm,
harmony. Differences of opinion are fine. Being able to actually have discourse is part of the beauty of what made America great, right? The whole world, of
yeah,
course, but I'm
from your
speaking
from
from
your
my
country.
my position, right? Everyone talks about like that's like the balance of power, the transfer of power, being able to communicate, being able to express your opinion without fear that the government or some power will actually keep you down. No, you can say whatever you want in this country, but you really can't now
Mm,
because you're going to offend somebody or whatever. But if you just speak like from the heart with the right intent, you should be able to have an appropriate
yeah,
conversation.
no, sure.
Unfortunately, not right now. So
Yeah, I think it's very strange. I think the way that we do things in the media is very nonsensical. If someone's come to speak about, I don't know, let's just say it's healthcare, and you give them the 3-minute segment, you can't talk about healthcare within a 3-minute segment. You're just going to be shouting things like a lunatic, and that's how it comes
right,
across, right?
exactly,
You watch
right,
CNN, you watch
exactly,
BBC. It's just people shouting because they've got so much to say in so little time, and you can trip
right.
yourself up when you're speaking that fast.
That's very true. So here in the United States, I'm sure you know of it. So there's the CNN, MSNBC, and Fox News. These are the three
Mm,
primary cable news networks. Of course, BBC and Scott, like all the stuff that you guys have. But in the United
just those
States,
three.
it's this, and yeah, and you can watch them on two. You can have a screen, an LED screen here, an LED screen here. You watch them at the same exact time, telling the exact same story. There's absolutely no
No
similarity
crossover.
in what you're being fed. Zero. It's like we're living in two completely different. And so, because people consume their
Yeah.
news, thank you. People consume their news from basically one source. That's what they're fed. That's what they
Mm,
believe. That's what they hear, and that's what it is. These people are over here. These people are listening to this. It's a shame. There should be like a mandate that there's a channel where you get both sides. It could be polarized
yeah.
sides, but you have to listen to both
Maybe
sides.
something
But
where it's
they
just
obviously,
this happened and no commentary. That's
yeah,
it.
that's what it
Yeah.
should be. Just the news. Like, yeah, just the news. But it's always bad news. Like,
I don't watch the
this
news,
many people
actually.
were shot. I don't, you know what? I don't watch TV. So I try not to consume TV that way. And this is basically what I watch. But this is the same thing. If you consistently are looking at left things, you're going to get left things. If you're looking at right things, you're going to get right things.
Yeah. Did you see The
So
Social Network on Netflix?
I haven't seen
I've
it.
not
I
seen
haven't
all of it.
seen it.
I've just seen reviews of it. But there was a clip that I was watching the other day where the guy was saying, "Look, if you watch loads of something, the social networks want you on their network longer. So let's just say you watch a chemtrails video, and this is something that went crazy back, a while back, or flat Earth, and you watch loads of flat Earth, they're going to recommend to you more and more flat Earth because it's what keeps you on there. And then the sensible comment, sensible content gets less and less because you've already seen that stuff, and you go into the more wild and wacky stuff. They just keep on feeding the wackier and wackier stuff, and you're on there longer and longer, and suddenly you come out and you're just this insane person.
Yeah, that's exactly right. The more you watch that shit, the more it's going to permeate.
Yeah.
It's not good.
So I mean, that's kind of how it works. So you just got to be mindful, really. I think that's why I don't know if you
Yeah.
watch Joe Rogan, his podcast.
I mean, I know who Joe Rogan is.
Yeah,
From time to time.
I mean, I love it. This is kind of one of the reasons I started this and why I moved off of Instagram Live, because I like to have a bit longer to just go deep into things. He does podcasts and he lets the person say everything they believe, and then he'll call
Right.
them out and stuff, pleasantly, and they're happy to come back. It's not like he's really really made them upset and stuff like that, but they get to the bottom of what someone truly believes without having to do
Right.
that 3 minute segment of screaming at you and trying to get everything out in 1 minute. And that's what
That's huge.
I kind of love about it, and why I decided, you know what, dentists can do this as well. Well, let's find out what makes Jason Auerbach tick. Let's find out what makes all these other guys who they are.
That's actually true. In a longer format, you also can't
Oh,
hide who you really are. It comes through
maybe I'll
completely.
try one day,
I
and
mean,
I'll be like something. I'll be a different person, just see if I can hold up the facade.
nah. I mean, you could do it for a couple of
Yeah,
hours. You could do it for a couple of years, but the fact is in the long run, it always comes
yeah.
out. It always does.
Yeah, exactly. Mate, I think we'll start to wrap up there. I don't want to take up too much of your time. There's one last question I'd like to ask you. Is there anything that I should have asked you that I didn't know enough to ask you? One of those weird, uh, like, who are you, and what should I have asked you to get a bit more of your personality out there? Something that you think the world should know about you that I didn't know enough to ask.
Um, I think that that's a great question. I think probably the thing that most people I guess if you watch me, the things that make me tick, the
Mm,
things that are interesting to me. What do I do? You know, on my free time. What am I really passionate about? External to my professional life, my family, and whatever it is. I mean, and I touched on it. I'm very, very, very big into music. I go see live music all the time, and music moves me. All kinds of music, everything from some. I don't listen to much classical music, but just in terms of
yeah,
the spectrum, classical music all the way up to 90s hip hop, like literally and everything in between. But I think that part of what makes me me, the big part of what makes me me, is live music. And the fact that it's absent from my life and the lives of so many, and the musicians and the venues and
yeah.
all of that is a terrible, terrible problem for our culture, because music is it keeps everybody together. I mean, music is everything. So I think my love for music, that's
Yeah,
basically it.
one final thing. Top 5 gigs you've been to, and
Sure.
thank you for the question, Diamond Joe.
Top five. I mean, I think three of the top five were fairly well. So I'm a big Grateful Dead
Okay.
fan, right? So you called me a deadhead or whatever it is. So there was a Fare Thee Well tour when they basically reunited maybe a handful of years ago in Chicago, and there were 3 shows back to back to back, and those 3 shows were pretty special. So Fare Thee Well, if you want to count it as 1, or you want to count it as 3, that was pretty special. I've seen the Rolling Stones live. I would say, I don't know, a handful of times. They're an amazing band. Pearl Jam, right when they first started performing, I was in college. I was an undergrad. When I should say when they started becoming big, I was an undergrad, and I saw them live actually the night before Kurt Cobain killed himself. It was totally unrelated, but I saw them at in Albany, New York. That was an intense, amazing experience and a great show. I've seen Billy Joel 1,000 times. I love him. Elton John, Eric Clapton, U2, Red Hot Chili Peppers. I mean,
I get the feeling you could go on and on and on.
I could go on and on and on. I love it.
Yeah.
I love it all.
No, it's been an absolute pleasure having you on. Where can we find you online? Anything you want to plug before we shut up shop?
Yeah, I mean, so I think anyone watching this knows about BloodyToothGuy on Instagram. BloodyToothGuy, I also has a YouTube channel. There's not a lot of content there, but there will be. So if maybe you go there and you subscribe to it, you can see some of the stuff that's on there long form. But I think as time goes on, I'm going to populate that channel to some degree. And then, of course, my business, Riverside Oral Surgery. So riversideoralsurgery.com, Riverside Oral Surgery on Instagram, on Facebook. And, I love that. I appreciate it. If you get anything out of me from the BloodyToothGuy stuff, maybe give me some love to the Riverside Oral Surgery stuff.
Guys, I will definitely tag Riverside in the description underneath the video. And if you're looking for the BloodyToothGuy YouTube channel, it's actually on my channels. If you have a look on Hot Pot Podcast, it's on one of the tabs there. You'll find it in there as well. Been an absolute pleasure talking to you. If you want to come back at any point, I feel like we could talk for hours and hours about a whole host of things. This has been a real pleasure. This has been Friday Night Live. We are going live every Friday, more or less at 8 p.m. And actually, now that we're in lockdown 2.0 in the UK, pretty much every night at 8 p.m. until we're out of lockdown. So keep tuned, guys. This has been an amazing, amazing experience speaking to someone who's at the top of their game. And if you enjoyed everything that you've seen here, make sure to subscribe, like, comment. And if you're really, really enjoying stuff, have a look at the Patreon group where you can help me out. This has been Jason. Thank you.
Thank you so much. Really appreciate it. This has been amazing. And I hope you guys get out of lockdown again quickly and everyone stays safe and healthy. And as you know, all love.
Absolutely. Stay safe, guys. Stay safe, guys. And we'll see you next time.
All right. Be good.
All right. We're